Hi, everybody, and welcome. My name is Leanne Moyer. I'm the owner of Portland Mom Collective, and I have with me here today Dr. Ryan Hassan from Clackamas and Oregon Pediatrics. This video is recorded in partnership with the U.S. Department of Health and Human Services. And we know that many parents still have questions about COVID-19 vaccines for children. So we took a poll, gathered some questions up, and Dr. Hassan is here to help answer them. So thank you, Dr. Hassan, for being here and welcome.
Thanks very much for having me.
My pleasure. So let's just jump right in and ask, I think, one of the questions that's at the top of everyone's mind, which is how safe and effective are COVID-19 vaccines for kids?
Well, they're very safe and they're very effective. We know that at least for kids 5 and up, they work very well. They have been carefully tested and monitored, and they continue to be carefully monitored using multiple reporting systems. There have already been more than 26 million kids who've gotten a COVID vaccine, and they go through rigorous trials and testing before it's even approved. And they have to meet the highest standards for safety and effectiveness set by the FDA and CDC, which is more than can be said for most other medicines, which don't need to be as safe because they're given when people are sick, versus vaccines are given when people are healthy, so they need to be even more stringent and even more closely monitored than our foods as well.
Okay, I think that's going to be reassuring to a lot of families. Another question we got was, can children get natural immunity against COVID instead of that provided by vaccines?
Yeah, so that's a good question. I like to start by pointing out that I think the term natural immunity is a bit of a misnomer, and I don't like using it because the implication is that there's somehow a difference between immunity from an infection and immunity from a vaccine, and that one is more natural than the other. In reality, when you become immune to something, what happens is your body's immune system recognizes something foreign in your body and creates an immune response and creates antibodies and memory cells. And that is the same process whether you get exposed to an infectious disease like COVID or a vaccine to protect against that disease like the COVID vaccine. So it's not as though one process is artificial or not. Your body creates the same natural immune response either way. What we know is that when you get infected with COVID, you do get an immune response to it, but it's very varied what that will be. We've seen very different immune responses from different people. It's not the same depending on who you are. You might have a more robust or less robust immune response. We also know that regardless of how you react to COVID, if you get sick, your immunity does wane over time, and you are able to get sick again, and we've seen many people with repeat infections, and you aren't protected from severe illness. By contrast, we know that if you get a COVID vaccine, you have a more homogeneous immune response, meaning everyone's going to have a pretty similar immune response to it. And that's a very good response that has better long-term protection, especially if you get a booster dose from any infection. And even more importantly, significant protection long-term with or without a booster from severe disease. So that's I think the important difference, and it's helpful. It's better to, in my opinion, get a vaccine where you know you're going to be protected and not take the risk of an infection that hopefully will be minor and still be annoying, or if you're unlucky, be more serious.
Yeah, okay. Well, should we be concerned about COVID vaccine side effects for kids, including the risk of myocarditis, which I've heard about?
So it's important to be mindful of the risks of the side effects from the vaccine, but to weigh those risks against the risk of infection. So we know that COVID is a greater threat to your kids and to our kids than any potential risk from vaccine side effects. Some kids have no side effects at all. Most common side effects kids do get are going to be a sore arm or tiredness or maybe headache for a few days. Symptoms from COVID can last much longer and often do. For the vaccine, there are rare cases, very rare cases of myocarditis, inflammation around the heart,
Yeah.
especially in kids, mainly boys, aged 12 to 17. But even in those highest risk kiddos, boys from 12 to 17, they are much higher risk of being hospitalized from COVID if unvaccinated, or getting much more severe myocarditis from COVID if unvaccinated, which is why the CDC, the American Academy of Pediatrics, both recommend that all children who are eligible get a COVID vaccine as soon as they can.
Okay, all right, that's great information. I was wondering how well are we seeing the 5 to 11 vaccines holding up, and if that group's will this group need boosters?
Yeah, so we're still learning. The research is ongoing, and so the recommendations are going to continue to be updated to reflect our most up-to-date knowledge. So as we learn more, we modify our recommendations to reflect what we know is safest. Right now, only kids 12 and up can get a Pfizer booster.
Right.
As we see, how immunity lasts, how well immunity lasts longer term, we may or may not decide that younger children also need a booster. As of now, hard to say.
Okay, let's talk a little bit about sort of how we go about things. Should unvaccinated children remain masked up even among vaccinated company?
Um, so uh, bottom line, I would say generally yes. It's always going to be kind of a balance of your comfort level and the risks. So masks can protect you; they do protect you and your child and others from COVID, especially if the COVID risk in your community is high. Now, the CDC has a really helpful tool and map where you can see your up-to-date county level transmission data, so you can see exactly how high the risk of COVID is in your county. And it can be helpful to talk with your doctor personally about, is it, how high is the risk right now, and how much benefit would there be from masking? But in general, I would say, it's always going to be beneficial to mask. The main downside is just, it's a little uncomfortable, maybe inconvenient, but it always is going to reduce the risk some. So personally, I'm still masking, whenever I'm out in crowded places or indoors, even though our risk is low here.
Well, that goes a little bit to a follow-up question, which was, can we go about normally after young children are fully vaccinated, as in no masks?
Yeah. I think there's a lot that goes into what normal means these days. But I think so. I mean, first off, CDC did recently release a new tool. They just mentioned that shows how what your community level risk is, and here in my county of Clackamas, it's pretty low right now. But it'll show if it's low, medium, or high, and that can help you decide whether you want to still wear a mask or not, because with a vaccine, your risk is certainly lower, and so it's safer to be around, to be out in public and around others without a mask than it would otherwise. But as we know, you can still get sick from COVID if you are vaccinated. So I think the things to consider are, what is, remembering you are protected from severe illness. So, what's your tolerance from more mild illness, which could happen if you are exposed to COVID while vaccinated. And then you do have people around you who are higher risk, even despite being vaccinated, or who are unvaccinated for whatever reason. So if you have people with chronic medical conditions or older people that you need to spend time in close proximity to, who might not do as well if they get sick, if they're exposed to you. So those are some of the things I take into account, when deciding when and whether to mask.
Okay. All right. All great feedback. I think we have time for one more question. So, what is the current position on regular annual COVID vaccines? What will it be similar to the flu shot?
Yeah, so it's hard to know right now. Right now, as I said, we're still learning more. The research is ongoing, and the recommendations are going to continue to reflect our latest knowledge. It's possible that we may need more regular booster doses in the future. Right now, it's unclear. It doesn't seem like it to me, but it's really going to depend on how this pandemic continues to evolve, what our transmission levels turn into in the coming months, what new variants arise. Any new variants that come up are going to have to be more infectious than prior variants, because that's how they overtake prior variants. We don't know how severe they might be. They hopefully will be less severe, but they could be more severe. And so those things are going to kind of determine, whether we need ongoing boosters. And of course, how well the long-term immunity lasts after a single booster, which again, we're also still learning. So hard to know right now. We're going to have to kind of see what the data shows us.
Okay. Well, thank you for answering some of those questions that we gathered up. We will be publishing a recap of this interview for everyone to reference on our website, so keep an eye out for that shortly. We'll also include information about Dr. Hassan and Clackamas and Oregon Pediatrics, so you can know where to find them. And Dr. Hassan, just thank you so much for taking some time out of your day to share your knowledge with us.
Yeah, my pleasure. Thanks for having me.
Have a good one.